Welcome to this month's Minute with Victor, where Dr. Cotton answers your questions.
This month's question comes from a physician who writes, I frequently deal with end-of-life issues. One of the most difficult situations is when a family makes a request that we do everything. I had a 90-year-old patient who was in heart failure from aortic stenosis. Replacing her valve would have helped her failure, but I didn't think she'd survive the procedure, and even if she did, she probably wouldn't regain any level of function. Unfortunately, when I explained the situation to her family, they requested that we do everything. From a legal perspective, what does do everything mean? Well, let me start by saying that it doesn't mean that you should do everything, because everything includes a long list of every test and every treatment, and most of those aren't going to help the patient. So doing everything definitely means something less than doing everything. In order to figure out what it does mean, let's start by talking about how medical decisions are made. In most cases, we evaluate the patient and determine his or her goals. We then discuss the various options, we make a recommendation, and if the patient agrees, we proceed accordingly. Of course, in some situations, the patient doesn't agree. And when that happens, we offer something else. And we keep doing that until the patient agrees to something or until we run out of things to offer. But at no point in the process do we turn the controls over to the patient. Now, I know there's a big emphasis on patient-centered care, patient autonomy, patient rights, and so on, and those things have their place. But they don't give the patient control over the doctor. No matter what you call it, the doctor is still the doctor and the patient is still the patient. Now, with that said, what does do everything mean? Well, it doesn't mean do everything because that's impossible. And it's not an order which you have to follow because that's not how medical decisions are made. I think do everything is nothing more than a heartfelt plea. It's an abbreviated way of saying, do everything that you can to help me. In this situation, surgery would fix her heart, but she wouldn't survive the procedure, so that's not an option. It looks like you're left with managing her heart failure as best you can, and I'd explain to the family that that is everything. It's everything that medical science has to offer, and yes, you're doing it. From a legal perspective, a request to do everything obligates us to do whatever we can to help the patient. Of course, that's what we're planning to do anyway. Thanks again for listening.